Morning all. Today we are going to discuss regarding Community Health Nursing Second Chapter 4, which all of them question university asked in 2014 to 20. Mainly 9 different pattern of question university asked in last 6 year. So in this slide we'll discuss first 7 and next slide we'll discuss another points. So first one is the what is the facility and service at PHC, functions of PHC, then differentiate between PHC and subcenter, facilities and service at subcenter. This PHC and CHC we will discuss in another slide separately. Now we are going to discuss first one, what is subcenter, what is the facility of subcenter according to the IPHS. This subcenter is one of the main center, or we can tell the grassroots healthcare system in India. In 2005, totally 1.46 lakhs subcenter functioning in the country. There are 1,47,690 subcenter functioning in country March 2010. The main objectives of subcenter to specify the minimum assured service that subcenter is expected to provide and desirable service which the states and union territories should aspire to provide through these facilities. Minimum assured service and desired service provided through the subcenter. That is the main objectives of the subcenter. Second one, maintain quality of care. Maintained quality of care. Third one, facilitate monitoring and supervisions of these facilities. How or which are the basic desirable services providing through the subcenter, that monitoring and supervision. And next one, to make service provided more accountable and responsive to the people's needs. To provide the service based on needs. Right. These are the main objectives. Then categorizations. First one, type A. The facilities for conducting delivery will not available. So first one is the recommended service except the conducting delivery. Accepting conduct. Second one, including delivery too. First type A, there is no delivery. Second one, including delivery. In type B, there is expected conductor around 20 deliveries in month. That is two categories of subcenters. And what is the manpower of subcenter? First one, A&M, subcenter A, essential one, desirable one. In subcenter B, 2 essential. Health worker male 1, even subcenter B 2 1. C, staff nurse in subcenter B 1. And Safai 1 part time and subcenter B is full time. Manpower according to the 2007 guidelines, health worker female 1 existing and proposed is 2. Health worker male 1 and proposed is 1. And what are the service will get from the subcenter? One thing you should remember, in last time question they are asked exam, they asked 5-mark question. So that's why we are describing the subcenter in detail. So please study these things thoroughly, then only you can explain all point. So whenever university asks in 5-mark question, please write each function detail, then only you can complete what they aim, what they need. Okay, so that's why here we are providing the services. We are going to some detail. So first one is the maternal health, first one antenatal care, early registration, minimum 4 antenatal checkup, recording the tobacco use if mother is used, name based tracking system, urine test. Then provide information regarding the Janani Suraksha Yojana, identification of any sexually transmitted disease or reproductive transmitted infection. Then counseling and referral to the HIV or AIDS in intranatal essential type B subcenter. Here managing labor using pactograph, any danger signs, identification of first aid treatment like PPH, eclampsia, sepsis, promote referral, etc. In postnatal, ensure postnatal home visit 0, 3, 7 and 42 day of deliveries at homes and subcenters. Ensure 3, 7, 42 day visit in the institution delivery. In case of low birth weight, less than 2500 or 2.5 kg, additional visits are made 14, 21 and 28. Tracking of missed and left out of PNC, postnatal care. Then what is the child health? The newborn care corner in the labor room provide the essential newborn care, especially in type B subcenter. Promotion of exclusive breastfeeding for 6 months. Assess the growth and development of infant and under 5. Immunization service. Then as for adverse event following immunization. Immunization should provide family planning and contraception, initiate safe abortion service, MTP. Then curative service, especially provide treatment in minor elements like fever, diarrhea, ARA, worms, etc. And desirable 1 month clinic by the PHC medical officer. Then adolescent care, school health service, then control of endemic disease. Then another one is the disease surveillance, integrated disease surveillance project. Then in water and sanitation, disinfection of drinking water, testing the quality of water using the rapid test, promotion of sanitation including use the safe toilet and appropriate garbage disposal. In outreach services is home visit to check out the disease incidents report by the health workers, notify the medical officer of PHC immediately about any abnormal in case of cases like diarrhea, dysentery, fevers with rigors, fever with rash, flaccid paralysis of acute onsets in a disease less than 15 years, tetanus, fever with jaundice, fever with unconscious, minor serious AAFI, which she is come to across during her visit. And desirable, the visit of house is of eligible couples who need contraceptive service but are not currently using them. Then nutritional program, which all of them will come under this subcenter, National AIDS Control Program, National Vector-borne Disease to National Leprosy Eradication Program, revised National TB programs, then other programs regarding the non-communicable. So how we can conclude the service? Which are the staffing pattern? One male health worker, one female health worker. If it is type B, there's a 2 female health worker and 1 cleaner also. If type A, cleaner is part-time and type B is cleaner is full-time. And another one, which other function will do? Safe water supply, safe delivery, antenatal visit. If there is part B, intranatal care and postnatal visit also. Then Janani Suraksha Yojana, contraceptive planning implementations. Then if any disease, especially minor ailments notification, if it is minor ailments notification, especially dysentery and diarrhea, should be reported to the medical officer of the PHC. So always the medical officer of PHC is the head of the subcenter. Under the each PHC, there is 3 to 4 subcenter will come. Okay. So these are the main national health program will come under the communicable and non-communicable. This is some drug kits in the kit A and kit B, ORS, IFA, folic acid tablet, syrup, folic acid tablets, cotrimoxazole, zinc, vitamin A. Why zinc is using? Especially we can use this one for the diarrhea and dysentery. GB crystals, absorbent cottons, albendazole. Kit B is this all of them. Kit will be available in the subcenter. Then other drugs is available in the subcenter. BCG, DPT, OPV, that all basic immunization. I think commonly in our Kerala, Thursday afternoon, they are conducting immunization schedule in the subcenters. Syrup, cotrimoxazole, tablet, syrup, paracetamol, albendazole tapes, avalons, betadine, clovoids, campaigns, etc. This is a register of subcenter. Which all of them registration will done through the subcenters. First one is a eligible couple registration, then maternal and child health registration, then birth and death register, drug register, furnitures, communicable disease if it is we need to register, passive surveillance, especially malaria or any other diseases reported, then register recording the Janani Suraksha Yojana regarding mother and child, then register of maintenance of account including United Fund, records regarding the health programs, minor alignments register. Okay, here one point I just leave. Do you have any idea regarding the population? So that's question for you. So what how much population will cover the each subcenter in the plain area and rural tribal valley area? Please identify all students the population coverage of subcenter. That is one of the most important things. How much population will cover the each subcenter? Next, second question. What is the referral system? That and explain. This point is important. In subcenter last time they are asked in 5 mark. If we check in book textbook, some of the book we won't get adequate note. That's why we are explained very detailedly. Here in referral system also commonly study referral system, but in October 2005 university asked one question. Please not explain the concept of referral system. Discuss the problems of referral system in India and suggest solution for that problems. So not only referral system, what are the problems we are facing in India regarding this referral and how we can solve. So here I am going to discuss what is the referral system and problems, and one solution I will show you. If you come to know the exact problems, you have solution, right? So I will show you problems, what is the referral, and one solution I will show you. Then you just identify the other solutions, what are them we can identify in referral system in India. So first one is definition. Referral system is defined as a systems of transferring cases which are beyond the technical competence of one infrastructure to higher level of infrastructure in the institution having technical competency and all other resource provided desirable health service. It is nothing but the providing technical competence of one infrastructure to higher level of infrastructure. The referral system is a vertical in nature. Here the referred from the village of health post to subcenter or PHC, from there to subcenter to PHC, PHC to CHC, CHC to secondary care, then tertiary, then other medical colleges. This is a provision by bypassing 1 to 2 level up depending upon the nature. This is one of the diagram. We can see the level of care where we will begin in ANM or ASHA workers will be identified disease condition, that to subcenter, then PHC, then subcenter. This will go like this, right? So subcenter, PHC, CHC, district hospital, teaching hospital, and higher centers. Then what is the purpose? First one is to provide the need-based comprehensive care within the technical competency and resource at each level, primary health care infrastructure and efficiency and effectively. Second one, to help the people to avail specialized service, to provide the specialized service. Third one is the streamline the appropriate use of PHC infrastructure and specialized service in order to prevent the overloading of other institutions. Then what is the effective referral system? Well trained required number of professionals, medical equipment, supplies need for the referral, continuing training, guidelines and supervision, guiding of sanitary measure and disseminate information regarding the disease control, conduct health education section, provide logistic support in time of equipments and supplies regarding PHC, establish relations and functional relationship with other sectors involved in social and economical, organize transportation facility to case to be referred. And what is a referral? Hospital, secondary and tertiary, which all type of care need to provide, especially provide specialized clinical outpatient and inpatient care. Second one, to primary healthcare system provide primary healthcare message and teaching, discourage people to attending OPDs directly, and act as a teaching center of health and professionals, including the community health workers. This is a selection of referral cases. Serious patients. Patients have the serious signs and symptoms. Special diagnostic procedures patients. These are the immediate care needed. Pregnancy, labor, postnatal period, diarrhea with a dehydration, pain in abdomen or vomiting, heartburn, dyspnea, dyspepsia, continues with or without sputum. These are the main immediately referring cases. Then fever with the stiffness, fever not responding treatment, fever with the severe joint pain, breathing difficult, chest pain, jaundice, convulsion, coma. Now we can add this COVID-19 sign and symptoms also. This is a form of referral system that depend upon each sentence. There is small differences, but it should be mainly content, patient name, date of birth, date, name, OP, and what is the physician referral. Why physician is referring from one center to another. This all content should be in that referral form. This is another referral letter. This given to the doctor to through the patient patient. Mainly it will mainly mention the age, date, symptoms, treatment, then probable diagnosis, not finalized. If patient have any allergy regarding any medication or anything, then family history, reason for referral, why patient is referring, and last signature. Then advantages of referral case. Why we can refer the patient? Beneficial of patient because they receive effective care than the any primary health centers. Then beneficial to health workers because they are able to take care of patient which are within their level of competency, not frightened to handle difficulty cases. Then beneficial to management because the economical, highly trained and highly paid doctors, nurses and other professionals take care of patient. These are the key points of effective referral system. Mutual understanding each other's role. One thing we should remember, whenever we are referring from one center to another center, we should make sure that that center also, that service will be available, and that team, that hospital team also ready to accept this patient. So without knowing these all things, we won't refer the patient from one center to another. There's too much cases is like that. If refer patient from one center to another, they won't accept, then that patient will be transporting from that system to another. So like that cases is there. So we should be alert that care is available. And another one more point, if patient is something serious, one nurse, emergency caring nurse should be accompanied in serious situation, and oxygen, basic life saving medication, everything should be available in that transporting system. Then mutual respect, mutual cooperation. These are the effectiveness of referral system. What is the nurse's role in referral system? Observe and collect information about the patient history, identify the nature of illness and emergency, provide immediate treatment care, then assure the casualty family members, any other person accompany, explain about the seriousness of problems, situation and need for reference to the casualty, fill up the referral form as desired and handed over, arrange the transport of patients according to the feasibility as soon as possible, may do the telephonic consultation or provide information referred to the health centers, may accompany the casualty with or patient if required or feasible, maintain records and reports. This is one of the important things, and provide follow-up care as per treatment and instruction prescribed by the referral unit. And one more thing should be remember, before referring, we should make sure that patient can be affordable, that referring hospital payment. That also should be make sure before referral. This is a simple steps we have discussed very detailed. This is a simple step. Please remember: establish good relationship with the patient, establish need for the referral. Then third one, set objective for the referral. This simple one, so only 8 points. Explore resource availability. Then fifth one, patient decide to use or not. We should make sure that where we are going to refer, that resource is available. Second, is it patient ready to transport from that PHC or somewhere to that higher level of care. Then make pre-referral treatment, facilitate and coordinate all referral service, and evaluate and follow. Please study this, at least these steps in by heart and explain. This is some of the issues we are facing in the referral systems, what we are told. First one, excessive regulation. Too much regulation is there really if referring patient from one center to another. Excessive regulation. Another one, shortage of doctors. You support if your patient we are referring from night time. If patient is coming to the PHC in night time, some PHC that service is not available, but some of them it is there. So shortage of doctors. If supposing patient is referred from one center to another, that after evening or after OP time, sometimes there's a really the shortage of doctors, especially maybe in our place we won't feel, but if you are going to North India and all, really there is a shortage of doctors. And another one, insurance companies issues regarding claim issues and all will come. And another one, papers. This is one of the important things. There is too much papers, formalities we need to complete, and some pharmaceutical issues will come regarding the medication. So this is one of the solution I am showing, the e-referral. Now still not yet here implemented. If all hospital, public and private, is coming under one referral system, we can do nowadays. I think every day in Ernakulam district, I think if any communicable disease or any COVID cases coming, I think there is one form is there, especially regarding TB and all. There is one form is there in private hospital. They will fill that form and they are submitting that paper directly. That still they are using paper. So this is one of the best solution for the effective referral, e-referral system. So if it communicate or if there are network for all hospitals in within one click, so they can refer patient to the easily. So this is one of the solution, and please identify regarding these problems based make it solution. So okay, this is a referral system, and we are going to discuss one more point also, records and reports. Maintenance of records and reports. I think 3 time university asked. In one time means 2 mark, differentiate, and another 2 time 5 mark. Okay, so just briefly we'll discuss. If asked, we'll complete. Records. Records is a permanent return communication that document information relevant to the client healthcare management. A record is a clinical and scientific, administrative and legal documents, and reports are the oral or written exchange the information. Reports is a summary of service, the person, personnel, and other agency. What is the purpose of records? One is supportive data. Then provide the practitioners which data is required for the application of provision service for the improvement of family health. Then it is a communication between health worker and family and other development personnel. Effective health records show the health problems in family and other factors that affect health. It is indicate the plan of future. It improvement of nursing care. Then this is one of the important things, principle of record writing. Nurse should develop their own method of expression and form in record writing. Second one, written clearly, appropriately, and adequately. Third one, contain fact based on observation, conversation, and action. Then select relevant fact and recording should be neat, complete, and uniform. The next one, valuable legal document, and so it should be handled carefully and accounted for. Records should be written immediately after an interview. Records are confidential document, accurately dated, timed, and signed. Not to include abbreviation jargons and meaningless phrases. Then, which are the hospital settings using reports? First one, change of shift reporter or 24-hour report, first record. Second one, for individual and family health record. Third one, for doctor health records. Then higher authorities record. These are the other type of records. One is cumulative or continuing record, family record. These are some of the forms: case, card and register, family record, eligible couple and child register, sterilization IUD register, MCH card or register, child card or register, birth and death register, subcenter, PHC, clinic register, stock and issue register, reports of blood test of malaria, filaria and TB, malaria parasite positive case register and others. Diaries are diary of male and female, diary of health workers, then return monthly report of health working, any complication, PHC monthly report, cumulative and family record is additional. Then these are the record maintained in the hospital: clinical record, record of nurses observation, nurses note, record of order carried out, record of treatment, record of admission discharge, record of equipment loss and replacement, record of personal performance. Okay, next one is a nursing report. Reports are complete daily, weekly, monthly, quarterly, and annually. Reports summarize the service of the nurses and other agencies. What is the importance of reports? Good reports save the duplication of efforts and eliminate the needs of investigation to learn fact in situation. Full reports often save embarrassment due to ignorance of situation. Patients receive better care when reports are thorough and give all pertinent data. Then complete reports give sense of security which comes from knowing all factors in situation. It help in efficient management of wards. What is criteria? Report should be made properly. Then good report is clear, complete, concise. The return is all pertinent. Identify the data, include date and time, people concerned, situation, signature, persons making the report. It is clearly stated and well organized. No extraneous materials include. Good oral reports are clearly expressed, presented in an interesting manner. Important points are emphasized. Share the significant information about family members. Continuously review the ongoing discharge plan. Do not engage in gossip. Describe instruction given the teaching plan and client response. This is a transfer report. Transfer report which include the nurse sending unit to the nurse receiving unit, the client name, age, primary doctor, medical diagnosis, which all are the content need in that transfer report. Summary of medical progress, if any allergy please mention, physical and psychosocial level, current nursing diagnosis, problems, critical assessment, need of special equipments or any care need. This is an incidence report. The nurse who witnessed the incidents or who found the client at the time of incident should file the report. Nurse describe in concise what happened, especially objective times. The nurse should not interrupt or attempt to explain the case of incident. Nurse describe objective the client condition when the incident was discovered. No nurse is blamed in incident report. The report is submitted as soon as possible. Nurse should never make photocopy of an incident report. Then another one, census report. Here number of patient, number of admission, discharge, transfer, birth and death will come under the census report. Then birth and death report, anecdotal reports. It is regarding some brief account of some incidents, especially incidents report and reports on the accidents, mistake, complaints about the legal issues in anecdote. Then this is a one small sample of the accidents report. How to write a better report before anything can be written clearly. The reports lacking fact may be biased or worthless. Consciousness, accuracy, completeness are essential to good report. It is better to write several reports that one who there is more than one main subject upon which report. This is terminologies. Use terminology in keeping the nature of reports short, simple, commonly used words, specific rather than general, scientific terms, single meaningful terms rather than praise. Let us observe mechanics. Use good sentence and paragraph. Observe margins. Spells properly. Use correct pronouns. Do not forget punctuations. Be neat. Write report in conversational manner. Date report. If reports is typed in someone else, check it before signing. This all of them should be in the records. So here we are concluding. I know this whole topic just we are going very fastly because of time shortage and uploading issues. So I have sincere request, please take these images screenshot and study thoroughly and focus this question, and another next section questions will be uploaded in the part B videos. Please watch that also. Thank you. Have a nice day.